Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone, and welcome back to the Movement Driven Podcast. I'm Dara here with Dr. Greg Goldberger. How you doing today?
I'm doing well. How are you, Dara?
Doing good. We were just chatting about how things are going pretty well with Movement Driven in general. Now that we've kind of moved into a new facility for our Jacksonville location, we're in the Tailwinds CrossFit gym and the Elite Wellness Center.
That's right.
And there is a massage therapist and a mental health
professional. Yep.
Yeah. And now Movement Driven.
There
So
you
there's
go.
a PT in here. So
There it is.
you get your CrossFit on, and then you have multiple ways to be recovered and revived.
One-stop shop, baby.
Exactly. So today we're going to talk about something that everyone kind of throws around, but it is kind of a big deal. But it's I think it has a negative connotation when there's a lot of good that can come from it too, and that's inflammation. So let's talk about what it is and the good and the bad, and why does some of that pain seem to not go away?
Yeah, I think inflammation does get a bad rap, but essentially inflammation is absolutely necessary for us to heal, right? So in the short term, we need inflammation to bring the right cells to heal the tissues, clean out the crappy damaged cells. But I think people kind of misconstrue that when they have some chronic pain, that they're just constantly inflamed. And sometimes there is an underlying component of, hey, I do have overall increased inflammation in my body. Maybe it's a gut health issue. Maybe you are on some kind of autoimmune spectrum or autoimmune disease, and somewhere on that spectrum of what I see. But for the most part, in terms of musculoskeletal injury and inflammation, we want to have inflammation. It's just a matter of if that becomes more chronic, or what's actually causing our pain in the long term. It might not be inflammation. So that's kind of what we're going to get into today on today's episode.
Yeah, so we're going to talk about like how long it lasts, and so that people can kind of get a little bit of an indicator of like, okay, this is just inflammation or response to a tough workout, or or protective of some sort of, maybe I strained my ankle or hurt my wrist a little bit, and I've got some inflammation around there. When people are experiencing that, what is like a good time frame to be like, okay, this is just my body's response? And then if it exceeds beyond that, to kind of say like, okay, there is a little bit of extra inflammation going on here.
Yeah, so I think like in normal healing processes, when the body is as healthy as it can be, inflammation should be somewhat predictable, right? So it's our body's natural way of healing itself. We need that inflammation. We obviously we have swelling, we have redness, we have pain, blood flow increases, and then we have what seems to be an issue, but that's just its body going through that first stage, which is about 0 to 5 days of all of that blood flow rushing in. Cells are coming to clean up the damage and whatnot. Then it goes into the proliferation stage, which, depending on the injury, can be several more days up to a few weeks. And then we go into what we refer to as a remodeling stage. And that's where collagen is coming down in, tissues are adapting, tissues are being more resilient. And that can be for several weeks up to 2 to 3 months, depending on the injury. So in a typical ankle sprain, you should have gradual decrease in pain after those first few, let's say 5 days, that inflammatory phase. After that, we should have a gradual decrease in pain, assuming that we're facilitating the healing process the right way. And if you still have pain 3 months post-injury, either your body hasn't learned to adapt, i.e. it hasn't regained strength, it hasn't regained range of motion, and it's actually started to compensate, and now we have a whole set of other reasons that why we might be in pain, and that might not be inflammatory pain, which we'll get into in a second. But if you're still having pain of the same type and swelling and things like that, then that's your body not healing the right way. And now inflammation is stuck there, and we have to do certain methods, whether it's dry needling or effleurage massage or other modalities, to try to get some of that, what I would refer to as chronic, crappy, stagnant swelling, and get some new blood flow to the area. But for the most part, you should, after those 5 days, like I said, you should see a natural progression of feeling better, able to do more, functioning at a higher level. And if you're not, then we need to address it at that point for sure.
Yeah, absolutely. So you mentioned, feeling pain after the injury and extended pain beyond that.
Hmm.
So, what are there different types of pain? So, for the person who's listening, who's like, okay,
Yeah.
well, like, what pain am I experiencing? What is the difference in it? What are the different types of pain that somebody could be feeling?
I think this might be the most important thing for somebody to get from this episode, honestly. I think this is the most misunderstood thing from in general, but definitely for the clients that I treat. Like, I think the layperson usually thinks of pain as inflammation. Inflammation is pain and pain is inflammation. But there's so many other types of pain in the way that our nervous system is interacting with the world around us. We've talked about this before, pain is very much an output of the brain. It's a response to something. So if I put my hand on the hot stove, I don't feel pain, I feel heat in my body's nervous system, and my experiences and my, cognitive ability to understand that that's bad for my tissues. In a millisecond, we feel pain and we pull it away. But that's more of an output of the brain. So when we have pain, it's just inflammation. There's other things that could be causing that issue. So um, we talk about inflammatory. We can also talk about ischemic pain. So a lot of time when we have people come in and they've had pain for months or years, it's very unlikely that they still have active inflammation, especially our tendinopathies. Those are now what we see is the people with, all of these tendinitises, which means inflammation of the tendon. There's really no inflammatory markers present. So you can have, tennis elbow or Achilles tendinitis for months on end, and then if they were going to do an ultrasound or an MRI, they wouldn't see any active inflammation within the site. So why are you still in pain? I think a large reason for that is now it's turned into ischemic pain where the body actually wants more blood flow. So that spasmy feeling in your low back at the end of the day, or that pain around your knee that's alleviated with the right foam rolling or the right soft tissue work, that you're not doing anything to inflammation. You're doing something to increase blood flow. And so if you feel better after those types of things, that's a sign that we have ischemic pain from these prolonged positions. There's also kind of mechanical pain. So if mechanical pain would mean if I put my shoulder in a certain position and the joint's not moving well, and now I have just an actual mechanical compression on a tissue or a impingement, that type of thing.
Hmm.
Well, now it's not just inflammation at rest. It's no, when I do this, I compress a certain tissue, and that mechanical compression or that mechanical tension is going to create pain. Just enough pressure. If I poke you hard enough, you're going to say "ow"
Yeah.
right there.
Right.
So that's a mechanical pain there. Um, and then if we get a little bit more in the woodworks, we also have neuropathic pain, which a lot of people with sciatica know exactly what that is.
Yeah.
So nerve pain, nerve irritation, nerve injury, that's going to be your burning, your shooting, your tingling, your numbness, all of those very vague, I can't really pinpoint where it is.
Right.
Those are your neuropathic pains, which isn't necessary. It could be involved with inflammation, i.e., if a disc in the low back is inflamed and enough of that inflammation is around the nervous tissue, then that could then cause neuropathic pain.
Hmm.
But then we have two different pains going on there. And then the last thing I'll touch on real quick, and this is something we've talked about for those of you that have chronic pain out there, central sensitization, which essentially talks about the nervous system now being kind of at a more sensitized level, meaning our threshold of pain has dropped. It takes less to cross that threshold. And that has to do with a number of psychosocial factors where how long have you had the pain? How has it affected your stress, your ability to cope with that pain? Has it gotten worse over time? Has it affected your sleep and your eating and all of these stress factors? All of these things are going to have an influence on where that threshold is. And it's not just inflammation, mechanical disturbance, or ischemia, or even neuropathic pain at that point. It is our nervous system is now wound up to a point where it does not know how to interpret the potential threat, and it thinks everything is a threat. So, ow, 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 pain, pain,
Mm-mm-mm.
pain. And that's where I think a lot of people that have had back pain for years and years, they have at least a component of that where you can do all the strength training and all the mobility work in the world. If we don't fix kind of how you're perceiving and understanding and expecting pain, then there's always going to be a little bit left. So really, we're kind of breaking up into 4 or even 5 types of pain there. So inflammation is really just when you have that initial injury, that those first couple of weeks, that's inflammatory pain.
Mhm.
But other than that, even sorry to keep this is a long-winded answer to your question, but I had a back patient the other day. She came in with what appears to be a disc injury, and we talked about how you have inflammation right now in the disc because you just hurt a disc and your body's trying to heal itself. But most of her pain at that moment was I can't move, I'm in spasm,
Mm.
which is an ischemic component that's coming in there. Usually I would say most people have more than one type of pain. They're overlapping in these different phases, and we have to change the way in which we treat to affect those pains, or else nothing gets better.
Yeah, absolutely. So just while you were talking, it just kind of made me think of, I think everybody has heard me say several times on this podcast already is how I've had 2 knee surgeries
Yeah.
on the same knee.
Hmm.
The first one was a blown out ACL and it tore my meniscus. And then the second one was a second tear on my meniscus and I had a meniscectomy.
Hmm.
So a lot of the times when and doing the exercises that you have shown me for my knees or my hips to help my knees have been helpful. But there are a lot of times after running or after doing squats, or even when I'm not really doing squats, but I do need my lower legs to push press overhead or,
Hmm.
things like that. I do notice that my knee is swollen a
Hmm.
lot.
Hmm.
And it's not in pain per se. There's sometimes where it feels a little pain, or I can't sit for too long in one position, got to stretch it out.
Hmm.
So for the person who maybe is hearing all that you're saying, but is like, I don't get which one I am,
Hmm.
but can relate to this explanation. What would you say that kind of pain or inflammation is?
So for having swelling, there's going to be some component of active inflammation there.
Mm,
So when you're doing certain movements or you're going past a certain volume, you're getting to the point where there are tissues that are upset within that knee that are screaming and act like they need healing. So your
right.
body is sending inflammation. So that could be a little meniscus is still a little disrupted in there, or other types of things like that. Versus if you had knee pain you haven't worked out in 3 days and your knee pain's hurting at the end of the workday, but then you go and do some Theragun or you do some foam rolling around the quad or the distal hand or wherever the soreness is kind of
Mhm,
adjacent to, and you get better within a few minutes. That's more of like an ischemic pain where now things are pulling on the tissues,
mhm,
causing a mechanical pain, like,
right.
and then that can then elicit an inflammatory response. So that's
Gotcha.
where I'm saying they do feed off of each other.
For
There's
sure.
overlap, but when I'm taking a subjective history from a patient, that's why I'm asking, like, when is your pain? Is your
Mhm,
pain during the activity, right after the activity? Is it more when you're doing a prolonged position, i.e., back pain when I'm sitting or back pain when I'm standing for 45 minutes plus?
mhm,
Those things are going to cue me into what is the actual source of your main pain that you came to see us with. And that's going to dictate what exercises or what types of reps of those same exercises are we doing, or maybe I want you to do the foam rolling and the lacrosse ball rolling before because you have an ischemic pain and we need to read. There's just all of
so
these
many
things is
things.
what I'm thinking
Mhm,
of to play. It's not just you need these exercises and these stretches. It's no, there's a method to that madness.
yeah,
Um, and so if your practitioner isn't asking you those questions or thinking about it in depth like that,
yeah.
then we're just doing cookie cutter stuff and hoping that something sticks on the wall.
Yeah.
So
Or if you're just Googling and trying to understand what kind of pain or inflammation you're experiencing, it's always good to have,
right.
an expert,
For sure.
or, a physical therapist who's going to ask those questions that you had stated, to help kind of pinpoint where that pain and inflammation is coming from.
Right.
So okay, why doesn't pain go away? Why do so many people feel stuck in pain for months or years,
Yeah.
etc.?
I think a lot of it has to do with not facilitating the healing process the right way early on.
Mm,
So if you do have, say you do something and you herniate a disc, and then you're staying within, you're not moving the same, you're resting because that's what your instincts are telling you. That's, oh, you got to rest. Don't go squat, don't go run, don't go do this. So then you rest too much, then you get weaker, then you get tighter, then the compensation starts. So there's this snowball effect that happens with everybody, because most people that come to see me, I'm not seeing them in an inflammatory phase. I'm seeing them after they've gone through what they thought was the appropriate healing time.
mhm,
They've seen maybe other people and now they still have pain months later. So now I'm seeing them where compensations have formed. They're still in muscle guarding mode. They're having ischemic pain on top of things. And like we talked about before, that changes the mechanical load, which then can ignite other inflammation within the joint at question or what have you. So I think a lot of the time is early on when you have an injury, talk to the expert right away.
Right.
Allow them to give you some simple things to facilitate the healing process, to make sure we're getting rid of swelling at the right time, to make sure we're elevating and compressing if we need to make sure we're getting these types of exercises during that first inflammatory phase that are going to promote the right amount of inflammation and reducing any excessive inflammation. Then you get into the proliferative phase where now we're loading the tissues the right way and we're making sure that compensations aren't coming into play. Um, so sometimes when people come and see me right away, one or two visits might get them right back on track and they know what they need to do
Mhm.
versus you come see me 3, 4, 5 months after the injury. Now we need a few more visits because we have more things to fix. We
Yeah.
have the initial injury to address, plus all the compensations that you've had since, plus what compensations did you have beforehand that
Yeah.
led to the injury in the first place? Because a lot of the time it isn't just, oh, I stepped off the curb and sprained my ankle. It's no like I've been running and my ankle's bothering me. It's kind of over in this general area, and then it's my job to go in and figure that out. So talk to the expert early on, facilitate the healing process, make sure you don't stay in that inflammatory phase longer than you should, and then make sure that we don't get in the compensation mode, which sometimes happens and you can't prevent it. If you
Mhm.
if you have an injury and you're limping because you can't put enough weight on it, then so be it. But then we talk about, hey, maybe you need one crutch and normalize your gait pattern and take some load off in your hands so that you don't create those those compensations. So
Yeah.
I think that that's my easiest answer, but or that's my best answer to what you should do. Why it happens is the fact that people think they're still a teenager and they're gonna get better, and then they don't, and then
Yeah.
they're like, here I am.
Right.
So act sooner than later, and it'll be a much much it'll be painless compared to what it can be for some people
Right.
coming
Well, and I think
coming
that's
in.
what's great about the packages and programs that we offer here is that, you don't necessarily have to come once a week for an extended amount of time. Like
Right.
you get an 8, 12, 16 pack, you kind of just come when those kinds of flare ups happen, or, when you need, like, hey, I realize over the last couple of months, like, I'm doing the exercises, but you do the exercise, but you don't have someone watching you do them.
Hmm.
So like you can, I'm guilty of it as well. Like I'm like, oh yeah, like my windshield wiper is like 5 seconds, 5 seconds, right
Right.
there, done. But I'm not doing like 10 sets of five,
Yeah, yeah,
or
yeah.
whatever the case
And I
is.
think over time, those reps should adapt, and you
Yeah.
shouldn't have to do the same amount, or there should be a progression. But I think to your point, physical therapy, that's why I've set up movement driven different than traditional therapy. The
Hmm.
fact that they expect you to go 2 times a week for 4 to 6 weeks, first of all, I don't have time for that. Do you have time for that? I don't have time for that. So personally, as a therapist, I'd rather see my clients 8 times over 6 months than 8 times over the next 3 to 4 weeks,
Right.
because then because I don't need to see you that much of the first phase.
Right.
What are we doing? I hear your exercises, do it. Here's your videos. We went over and so I made sure your form was good here.
Yeah.
We're gonna review once a week when you do come in. But then as soon as you're out of that pain stage, once a week for 3 to 4 weeks, now I want to see you every 2 weeks, every 4 weeks, and then so on,
Absolutely.
so that we're actually building strength and not just, come in and let's do more massage for the sake of doing massage.
Right.
All that's helpful, but we're trying to facilitate the way that the body's responding on the body's timeline,
Hmm.
not on just some arbitrary thing that probably the insurance company came
Right.
up with years ago. Like
Right.
2 to 3 times a week for 4 to 6 weeks. Like, why is that? Who said 4 to 6?
Right.
Why?
Right. Or like you have to do these exercises. We'll only pay the physician if he does these exercises. Or
Right.
like, okay, but
Don't touch our patient. Don't do manual therapy. We're not going to pay you.
right. Yeah.
Okay, I'm going to do what I think is best. And and to answer my own question, I'll tell you where 4 to 6 came from. 4 to 6 weeks is like an average time length for soft tissue to heal.
Hmm.
6 to 8 was like kind of the definitely should be good by 8 weeks for a general soft tissue injury, i.e., ligament sprain or tendon strain or what have you. And so there was just arbitrary. Oh, this is all they need, so this is all we're gonna give them. Well, okay, it takes 4 to 6 weeks for the body just to start to get stronger.
Right.
So just as we're done just managing your pain, Now it's time to actually rehabilitate the body and build resilience. And your insurance company's like, no, you're good. You can walk again.
Right.
Oh, thanks, but I want to run and I want to play with my kids and I want to have, a high
Yeah.
quality of life. So 2 middle fingers in the air to you.
Right.
I'm gonna go see Dr. Greg and Movement Driven. So yeah, the system is not designed to help you, and that's what we're trying to do a little bit
Yeah.
differently here.
Yeah, absolutely. So that's going to kind of segue into the problem with quick fixes.
Mhm.
So what about anti-inflammatories and injections? Do you maybe have an opinion on thinking that they might be good for some people if they need it, but the issue with just kind of taking a pill or taking a shot instead of actually like manually working through
Yeah,
pain?
I think I think both have to be accompanied by active rehab,
Mm,
right? Like they serve their purpose, and I'll go into a little bit of my opinion on that in a second. But if you're doing the anti-inflammatory or the steroid shot just to get rid of the pain, that's all you're doing. You're just putting you're just masking a symptom. You're
right.
treating a symptom, you're not treating what's causing the inflammation.
Band-aids on boo-boos.
And sometimes those things, yeah, band-aids on boo-boos, which we're not about here. Well, sometimes it's absolutely necessary. If you have so much pain and everything we're doing is so irritated to you, then I think sometimes a corticosteroid shot, it has its place. I probably hear this more than not, like, oh, I don't like taking anti-inflammatories. Like, well, that's fine, but sometimes they are necessary. If the
Hmm.
inflammation is too much and it's getting in the way of movement, then you should take the anti-inflammatory, but don't depend on it. But yeah, short answer is those things have their place, but we should actively trying to move in the right direction
Hmm.
so we're addressing the root cause and not just putting the band-aid on the boo-boo.
Okay. Awesome. Yeah. So I think maybe the biggest takeaway here is that pain isn't random.
No. Pain isn't there's always a reason for your pain. And I think sometimes people likely get frustrated because the way that they describe it, their practitioner's not really listening to them and just giving them
Mm,
a blanket take this pill or do
mhm,
this exercise. Or for our cases where there is like true central sensitization, there's not enough people, in my opinion, talking about that kind of stuff. And sometimes just understanding your pain is then allows you to know how to act on it and why you're doing these things. Then leads to more compliance for the
mm,
client, and then it leads to better results. So we're huge on education here. I really want my patients to understand what's going on in their bodies because it's their bodies
right.
and they're investing in their health. And so we're trying to do everything that we can to make sure that they reach their goals in a timely fashion. So it starts with listening and
Yeah.
really trying to identify what's the root cause here and how do we have an impact on it.
Yeah, awesome. Well, you all know the drill. If you are in the Jacksonville area and you're looking for someone who can help you get pain free and stay pain free without the quick fix, or in addition to those quick fixes, like we just talked about, you can see Dr. Greg. Just visit movementdriven.com and you can book a discovery call, 15 minutes for free. Just hop on the phone and kind of see what direction you need to go into. Or we do have a special for our podcast listeners that your first eval would be $79, and that's an hour-long appointment where you kinda get to know your body. Dr. Gray kinda does a few assessments on you, full body assessment, and then gets you moving, sends you off with some homework, and then we can also get on a program, that's gonna fit your schedule and your budget as well. So thank you, Dr. Greg. I think this was a great episode. I'm gonna go do my exercises after
There
this,
you go.
and then we'll catch you on the next one.
See you guys.
Thanks for tuning in to the Movement Driven podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.